Thank you all for joining this special webinar of SSGSA, the COVID-19 pandemic, coping with anxiety and uncertainty. Since a very interesting time is going on, and due to pandemic, many people many people are suffering from anxiety, from the uncertainties. So we thought to arrange a special webinar. And today we have the speaker, Dr. Ali Samshi Saab, who is uh, joining from Yale University, Connecticut. So may I request Ali Rizvi Sahab to introduce our speaker, and then we can go ahead with the presentation. So Ali Rizvi Sahab, you want to?
Thank you, Musifal. Assalamu alaikum, everyone, and it is a pleasure to welcome our guest today, the guest speaker today, Dr. Ali Shamsi. Dr. Shamsi is a graduate from the KGMC, Lucknow, that is King George's Medical College, Lucknow. He is a consultant psychiatrist to the state of Connecticut, USA, and an assistant clinical professor of psychiatry at Yale University. Apart from this, Ali Shamsi Sahab was also from the same school as I went to, La Martiniere, Lucknow. He's a very fine man. He lives in Connecticut, and we have had the pleasure of interacting with him on many occasions. We have mentored many students, not from EMU separately, but he has also been a great mentor to many students who came from Lucknow, La Martiniere, came to Boston, and he was able to host them for 3-4 days in Connecticut. Ali Bhai had, his father also was in the same field, was a medical doctor, and they had a hospital in Lucknow. Last year, he passed away, and but Ali Bhai continues to serve society and humanity in many different ways. He is actively seen in many forums where they need help from him. And when I got this platform, I invite Ali Shamsi. Dr. Shamsi was very comfortable, and he said he had some other engagements, but he was kind enough sort of take our request and join us today for this session. He's very well renowned, and he does an amazing job in his field of medicine. And I'm sure all of you will have a very nice session with him. If you have any questions of him, please do ask him at the during or after the session. But on behalf of all of you, Wasikul is the chair. And Wasikul, you also may have heard about Ali Bhai, and you may have met him also, maybe not face to face, but I think online when you had gone to Switzerland. But Ali Shamsi is a great guy, a wonderful human being. But Ali Bhai mein ek kami hai, wo kami ye hai ki he is not an Alligerian. That's all. But today I think he will be mentoring Alligerians, so that's fine. Thank you so much, and welcome all.
Thanks a lot, Ali Rizvi Saab, for the introduction. So now may I request Dr. Ali Shamsi Saab to start his presentation. So I can share the slide. I can keep sharing the slides. So I will move the slides accordingly.
Okay, thank you very much. Everybody hear me?
Yes, we can.
Okay, thank you, Ali Bhai, for the introduction. I really appreciate those nice words of appreciation and encouragement. It means a lot coming from you, who's already a leading stalwart, a member of our community, not just on the East Coast, but all over the US. And it means a lot for those kind words too. But thank you for giving me the opportunity to do this presentation. That's where I'm grateful to you. This is a very important topic, and it's something that's of vital importance to students of this age, young men, young persons of this age, men and women of this age, boys and girls. So thank you for giving this opportunity. I'm very grateful to all the other help and support that you give in these times of uncertainty, in particular, but also in general. So we'll go through these slides, and then if somebody has questions, they can participate in the middle of the presentation also, but most questions are left for the end. and I let Wasikul manage how he wants to flow. So about myself, as Ali Bhai mentioned, I graduated from King George's Medical College in Lucknow, and I've been a psychiatrist now for the past 20 years. The topic of what's going on, the COVID-19 pandemic, is a very relevant topic for everybody. How this is panning out and how it is affecting the world has been just very, very uncertain. Each time we are able to make sense where this is going, something new happens, something that was not predicted before ends up happening, and individuals, institutions, everybody is having trouble trying to do this. In the health, there are certain that are used. Individuals are going through. That's just it. It could be small uncertainties at the personal level. It could be as a family, as a group, as an institution, or entire nations could be faced with uncertainty. But the broad principles are the same. And then there is the issue of anxiety that comes with uncertainty. It's bound to be there. What is anxiety? Anxiety is the fear of the unknown. Not just the thought of the fear of the unknown, but also how it affects your body. So when we say anxiety, we are talking about more or less like a medical symptom where you are also experiencing some bodily symptoms of, maybe your heart beating very fast, maybe you're not able to concentrate very well, maybe you're having sleeping, or you're finding the fear of the unknown is affecting maybe your appetite, how you interact with others. Having these two terms, let's move on to the next slide, please. If you could go to the next slide, please.
Yes,
Thank
yes.
you. So this is a millennial. In order to understand a phenomena that is great uncertainty, it helps to put things in context. So if we are as individuals, you could be a professional, you could be a young graduate coming out of college, you could be you could be running a business. Everybody is affected in this situation. There are jobs, people have lost jobs. Of course, we've heard of massive layoffs all around the world. We have heard of the migrant crisis in India. We have heard businesses being shut down all over the world. So when we do a situation as large, as massive as this, it helps to put things in context. Why that's important is that in the end, one has to have coping with it. So there's a trauma that is presented in individual. A trauma, it could be a personal level trauma, it could be a national catastrophe, it could be an accident, it could be an earthquake, it could be a mass fire, it could be war, it could be a pandemic like this. It helps to put things in context. Why does it help to put things in context? Because oftentimes we have to then change the plans that we had. So, we all around in our life math, doing such and such thing the next few months. We'll have the next 6 months. This is what I have next year. we will do this. So if you might have an examination coming up in 6 months, next year you'll be applying for jobs. Year after that, there could be some sort of life-changing event, apply yourself, all of that. So this is a once in a millennial event. Does that mean that once in 1,000 years is what is we are going through? It helps things to put a trauma catastrophe in context. If going through a personal trauma, as I said, if you're going through a motor vehicle accident, a loss of a dear one, if there is a natural calamity, an earthquake, or a war that breaks up, that disturbs our plans, that disrupts what we have in mind for ourselves for the next 6 months, for the next year, for the year after. Disruption of what we have imagined for ourselves, and the absence of a substitute for that plan for ourselves creates and induces anxiety. That's where the uncertainty comes in. So if the way our mind works is that if we have a roadmap for ourselves, we have imagined a future for ourselves. It could be the future over the next 6 months, the future that we have imagined for ourselves for the next year, or for the next 2 years, or the 5 years, the 10 years. That is the map that is in our head. And when circumstances and events come in and they wipe off that map, that wipe off that future, and we don't know what lies ahead, that's where uncertainty comes in, and that's where anxiety comes in. It is the absence of a replacement that can be put in for what we had already thought for ourselves. So I'm just trying to conceptualize how our mind works and how we think about a future, and the absence of a good enough replacement for that future is what creates anxiety. It could be small, minor things, or it could be large, life-changing things, or it could be events that shake up entire global orders. So again, the whole idea is to put things in perspective, to understand how massive this devastation is. What it does is that it gives individuals a sense of not blaming themselves. So if you are going through a situation where entire countries have, let's say the United States, for example, its GDP dropped by 25 to 30%. This is massive. This is huge. And it is bound to affect somebody. I'm just giving the example of US because it is a big example to compare. The same thing has happened in India. Indian GDP has contracted because of the coronavirus. It's gone down by almost 25, 30%. And so this is bound to affect everybody, and it is bound to affect us. Why is that helpful? It's helpful because it helps taking the blame away from us. The first reaction that we have when we are coping with uncertainty and anxiety is, what is it that I can do? Is it my fault? How could I have done differently that could have prevented me from being in this situation? And oftentimes the most comforting answer is that there really isn't much that I could have done. What we are going through, they are comparable with events like the plague that wiped off, close to almost 10 million to 30 million people, depending on what figures you want to see, in the 13th or the 14th century, across vast swaths of Asia, Europe, Africa. This is something on that scale in terms of scope and reach. So we have better technology, we have better medicine, so we don't have that amount of deaths, but that is the scope of what we are going through. It is the same illness as the Spanish flu, where, you know, depending on the figures that you want to believe, between 3 to 5 million people died. That happened at around the time of World War One. May I have the next slide, please? So, what causes our frustrations? Again, our frustrations are a function of our expectations. Expectations are not a bad thing. In fact, it is always, you know, rule of thumb, a good idea to have high expectations of ourselves. So why am I saying that then frustrations are a function of our expectations? Is just so that we understand our frustrations. So if we are going through something that we are feeling bad about, if there was a goal that we wanted, if there was an outcome that we wanted from our life, from an individual, from a relationship, from a job, from a career, and we are not able to reach it, there is a sense of frustration. The feeling that I wanted this outcome and that outcome has not come. And so it always helps to go back and look at what our expectations were. Not saying that you lower your expectations, but just that you make sense of the frustration. If depending on the disappointment, why am I feeling so disappointed? Because I had such high expectations, which is a good thing. High expectations is a good thing. It's just that when you're feeling disappointed, you need to remind yourself that this is the high expectation that I had for myself. The reward would have been very high, and the disappointment is also going to be a bit painful. That's all there is to it. Again, it helps to put things in perspective. So many young folks have not been able to take examinations. So many young folks, young graduates, young adults who are entering the job force have not been able to, you know, line up job interviews. They are forced to stay at home. They don't have a source of income coming in. And we are used to the script that we were handed over for no fault of ours. So, you know, 2 years ago, we were all set to finish our exams, graduate from university, and be working by now. And that did not happen. As I had said earlier, our vision for ourselves that we had, the dream that we had in our head, that this is where I would be, which is the way the brain works. You know, the brain works in images. So when we think about our future, we are actually thinking in images. So when we think that we will have a job, we are actually imagining ourselves sitting in an office, maybe with a computer. If we are planning for earning a salary 2 or 3 months from now, we are basically thinking in terms of an image of a nice car, or perhaps a good apartment, or some nice clothes, maybe even a wedding. So these are images with which the brain works. And what catastrophes and major events do is that they wipe off that image, and that image is gone. And we don't know how to replace that image, or what to replace it with. And that's where the anxiety and the uncertainty comes in. We are struggling to find a replacement of that dream, that image that we had about ourselves living a particular format in the future. So 2 years ago, we had a different image, a different dream of ourselves, and here we are, don't know how to replace that. And so again, It's a question of putting things in perspective, comparing our current situation with other comparable situations. If you were living, let's say, and in any major city that was going through a world war, the devastation that happened in London during the in 1942-43, when German planes were bombing entire neighborhoods. What would career planning at that time have been? Everything comes to a standstill. Um, uh, we, especially Indians, have not gone through such major catastrophes that some parts of the world have gone through. Uh, One must admit that the last, because I'm talking to an Indian audience, I'm trying to make a connection that is relatable. The last 70, 80 years, definitely a generation of Indians have gone past where they have not experienced catastrophe at the level that entire nation, that shocks entire regions. We've been shielded from that. India has not witnessed wars of that scale. India has not witnessed devastation from pandemics or natural disaster of that scale. And so we don't find anything that we can relate to in our living memory. Those that lived through the Bengal famine, for example, they're gone. They're no longer with us. Those that lived through, World War II, World War I, they're gone. There's nobody to tell us those stories. So I'm coming up with examples that we can closely relate to. So again, if you were living in a city like London that was being bombarded for non-stop for 2 years, what would career planning look like for you? There would be no career planning. There would be no future. There would be no plans. And the focus is on the here and now, survival. I'm not saying the situation is as bad, but it is comparable when you don't know what your academic future is going to be like, when you don't know what your job prospects are going to be like that. It takes a little bit of comforting to know that maybe it is time to pause and come up with ways of moving forward. And we'll talk about that going on to the next slide. So may I have the next slide, please?
Yes, sure.
So again, so these are the next few slides will be some broad principles of coping with uncertainty. The first step is to be kind to yourself. It's the most natural reaction is to blame yourself. Maybe I could have done something differently. What could I have done to prevent this? Sometimes stepping back and saying that, well, this is not my fault, is always the best answer. In the field of motivation, especially in high achievers, it is not the coolest thing to do to not blame yourself. It's the more competitive, the more high achieving you are, the more it is your tendency to blame yourself. And that's why it requires somebody else to tell you that, no, it is actually not the right thing to do to blame yourself and say, well, this really is not my fault, because that is the reality. If you accept the reality, then you will obviously find better ways of coping with it. So that's the first step. Be kind to yourself, and then you step back and then you look at on the past successes that you've had. So this is a question of you going back and looking at your strengths and weaknesses. What have your past successes been? You have survived, so go back and see what was it about you that made you survive in the past, and what lessons can you learn going forward in the future. Developing new skills. Sometimes it helps to, if you are going through an uncertainty that would require a change, in career, for example, that would require developing new skills. Then you have to start thinking yourselves, is there something new I need to learn? Is there a new exam that I should take? Is there a new, perhaps a different field I could take? If you were looking to start a particular career and you see that job prospects in that career are not going to be the same, or be very, very limited, it maybe is a time for me to fine tune or make some changes in the skills that I have, maybe a new specialty, a different stream in the profession that I have. So sometimes thinking about that helps. And limiting exposure to news. The more I talk about it, the lesser I need to talk about what news and misinformation does to us in this age. I mean, the audience that I'm talking to, young adults, early professionals, recent graduates, you're all well aware of the amount of fake news that is out there, and the amount of false news that is there, the misleading information that's there. Everybody has an agenda. Sorry to say, but news channels, news outlets all over the world grab on the headline that they think will give them the most clicks, the most eyeballs, the most shares, and that's where they make the money from. But what it does to individuals is that it sets them into a loop, an addictive loop of finding the next information, leading to the next information, leading to the next information. So if you go back and think about how your brain works when you're sitting on WhatsApp, you get a news feed and you click on it and you read it, and then your mind starts to look for a follow-up of that news. When you forward that clip, you're wondering what the reaction from other members of that group is going to be. You're fixated on that. Or if there is news that you don't like, you are looking forward to where can I get another news clipping, another WhatsApp forward that contradicts this and feeds into my version of what the right news is. So for example, if you think that the COVID vaccine is a conspiracy and it's, by some mega cartel of secret people that are out there to infect the world and make tons of money out there, and somebody sends you a WhatsApp forward that challenges that idea, you are on the lookout for finding another news item that feeds into your narrative. The same with politics, the same with humor, the same with all kinds of, so that's basically how our mind gets addicted to this sort of crazy information overload of the world of WhatsApp or Facebook. And no offense, I mean, I know that this is being broadcast on Facebook also, but I mean that these are all the good things, and so many of the preparation for this, for example, my communication with so many of you happens on WhatsApp. But unfortunately, this is where the information overload comes in, and it affects our ability to plan for the future. It really does. So exercise caution when it comes to the news, especially in this age. The lack of clarity there is on a topic, the more misinformation there will be, and the more anxiety it will be. So for the sake of your sanity, if you're finding that you are going through a situation where you are anxious, you're uncertain about a situation, about life events, about major global events that are causing you anxiety, then you limit your access news. Maybe check your news wherever you consume your news from, once a day. There really is no need to go back and keep checking on news feeds every 30 minutes, every hour, even 2 or 3 hours, because that's where the addiction comes in. For the sake of your own sanity, just prioritize, put a quota on the amount of news that you want to access. May I have the next line, please? So avoid dwelling on things that you can't control. Easier said than done. The more uncertain a situation is, the more imperative it is for you to focus on things that you can control. I mean, everybody has heard the story of the frog that fell in milk and, you know, tried to get out of it and churned the milk into a layer of cream and then sat on it and jumped out. So just focus on what you can control. Sitting together, and I'm going to come to this also, it's absolutely critical for you to have a circle of friends around you that tell you, that give you information, that give you feedback, that support you. And I'll talk about how important that is. But it's also very tempting to dwell on things that are of absolutely no consequence. So where is the politics of all of this going? You know, it is very easy to spend hours and hours talking about the politics of it. Where are all the conspiracy theories heading? How is this going to pan out? Yes, it's helpful to have a sort of broad idea of where things head, but spending hours and hours talking about situations that are absolutely outside your control, it really is counterproductive. Take your own advice. By that, I mean that we are our best judges. So we know where is it that we are going wrong and how is it that we can correct ourselves. Engage in self-care. And I'll come to this when I talk about anxiety. So engaging in self-care basically means looking after your own health. And let's move on to the next slide and we'll touch that topic there. May I have the next slide, please? So this particular slide is about seeking help as a sort of almost like a network. So we as human beings are social animals, and so there is this theory of resilience. Studies were done. Yes, so studies were done on children and individuals that came from trauma, and what is it about these folks that have a good outcome. So children that come from broken families, individuals that come from broken families, some progress in life and have good outcomes, they do spectacular work, achieve vast successes in life, and some don't. So what is it about these folks that sets them apart? And research shows that those individuals that have the ability to make social connections are the ones that do best in life. What does that mean? So to cut a long story short, individuals that make social connections are the ones that are able to identify what is it their strength, what is it that is their weakness, and how can they seek help from others to complement their weaknesses. So as humans, we live in a world full of humans, and it is humans that help humans. Nobody's perfect. Everybody has strengths and weaknesses. If you're preparing for an examination, you have some strengths in understanding the subject. There's some parts, the vast subjects, that you don't understand. Who is in your friend circle that has a better understanding of that topic that can help you out? When you're approaching, same thing, when you're going for a job interview, when you're preparing early on, if you're an early career individual, this is your first job, you don't know all the aspects of that job. Who are those that can help you understand those aspects of your job? If you are, in a new city, a new town, for example, what are the avenues that you need help from? Maybe you need somebody who can help you find an apartment. Maybe you need somebody who can help you find a job, for example. So the most successful individuals, people that have the best outcome in uncertainty, are those that have the best ability to understand where is it that they need help from, and how do they go around looking for help, and then how do they make sure that the individuals that are going to help them are going to stay with them in a relationship of cooperation. So go out there and try to look for people that can help you. Find a way of helping them. Make that your support network, make that your support group, and stick with it. That is the best way of coping with uncertainty and planning for the future, frankly. May I have the next slide, please? Okay, so anxiety. As I had mentioned earlier on, anxiety is almost a medical term, which means broadly, the thought of anxiety is the fear of the unknown, not knowing what lies ahead, and how that fear affects our body in terms of affecting our sleep, even a little bit in terms of affecting, our appetite, maybe in terms of affecting our ability of maintaining a calm demeanor about ourselves, including our ability to have meaningful discussions in relationships. So when there is an uncertainty and it starts to affect our own selves, our well-being, our feeling of happiness, that's what is anxiety. Why is this important? Is it helps to understand what we are going through. And the culture that I come from, the culture that you all and I share, the Eastern culture, the culture from India, it's not taught to us. It's not encouraged. We are not encouraged to talk about our feelings, what we are going through. It's just not part of our vocabulary. So if we are going through anxiety, then we have to ask ourselves and tell ourselves that we are getting anxious. I am getting anxious. मुझे घबराहट हो रही है. So in our culture, when we say मुझे घबराहट हो रही है, it requires a lot of anxiety for us to reach that state. But it helps to, as I said, we are not trained into it. This is not part of our culture, and we need to teach ourselves to recognize what our feelings are and start talking about it. Take time out. So. And I'll talk about it later. What is the best way to take time out? But take a break. If you are finding that you don't have solutions, you don't know how to cope, then just take a break. Take an hour, 2 hour break. Some of us have religious practices. They help. If you have a schedule of your religious practices, that you go to a place of worship, or you take time out from the day several times a day, focusing on your connection, a spiritual connection, that's good enough. That's good enough. But the idea is to step out from the busy day, 5 minutes, 10 minutes, and then you can go back in. These small moments of meditation, break, spiritual connection, they help cope with anxiety. Having a healthy meal and healthy lifestyle is absolutely critical. It's absolutely critical with helping anxiety. It's very easy to get into bad habits of overeating or undereating. Individuals are found to have gained weight over extended periods of anxiety, uncertainty. Psychological uncertainty and trauma is known to make people gain weight over a period of time. So that just adds to the cycle of worsening anxiety, weight gain, loss of social support, and the cycle continues. In our culture, tea drinking, especially in Aligarh, having tea, the culture that I remember my days in KGMC, we could drink anywhere between 10 to 20 cups of tea, the whole day long, the whole night long. I know Aligarh is famous for drinking tea. It's not a good thing. It just is not a good thing. The It has a lot of caffeine. Tea has caffeine, and caffeine can make you nervous. Caffeine can give you anxiety. It does. The half-life of caffeine, like it stays in your system for 12 hours. So caffeine, there are a lot of folks out there that are known as slow metabolizers of caffeine, in which caffeine can stay in the system for much longer than that. It creates anxiety, it creates nervousness, it'll limit your sleep, it will make you jittery. If you have too much of caffeine, you can get angry, you can get snappy, and then you have caffeine withdrawals. It can give you headaches. So I've gone through that, and I wish somebody had told me not to drink, the 10 cups of tea that I drank when I was a young adult or passing out of college. So caffeine is the worst thing that you can do when you're going through anxiety. It's you can have some tea, some coffee, the beginning of the day, but that's just about it. An average individual has caffeine that stays in the system for 12 hours. You have a cup of coffee or some tea in the morning, the effect will last till pretty much as long as there is sunlight. So just remember this. May I have the next slide, please? If there are three things, if there are three words of advice that you can take from this talk, just three. It is, number one is make sure you get good sleep. Number two is you exercise daily. And number three, you have a support group of people around you that you can talk to. That's all. I cannot emphasize more on the need to get sleep. And the reason why I'm doing this is that the folks that I'm talking to, young adults, early career professionals, recent graduates, this is the age group where the first thing that gets sacrificed is sleep. You can stay up late till night, and then you find that you can still wake up the next morning and go to work, but your performance is diminished. It really is. What you can achieve by having a good night's sleep is way more than what you think that you're achieving by not having a good night's sleep. So just being awake and going about doing the bare minimum that you're doing because you stayed up all night is not the same as being productive at your maximum level. Make sure that you get a good sleep habit, and this is all the more important when you are going through a period of uncertainty, when you actually don't have a job to go to, when you actually don't know what your program is going to be, when you actually don't have an exam to study for because all exams are canceled, when you actually don't have a job to go to because nobody's giving you jobs, that is the time when your schedule will get disrupted. It'll go haywire. And that is the time when you bring in the most discipline at that very moment of your life. Make sure that you're sleeping well, because that's where, if you wake up the next morning and you have slept well, you'll have the healthy thoughts coming in. You will be relaxed. Your mind would have sort of sort through things. So what sleep does is that when you're sleeping, your brain is collecting the thoughts that it has processed the whole day long, that it is collected. It's like an inbox. So your brain, when you're awake the whole day, a lot of conversations, a lot of sort of experiences that you're going through, it's collecting almost in an inbox of an email. And then when you're sleeping, your brain is then processing through it. You must have heard, those are major achievements and scientific breakthroughs that have happened when scientists and great intellectuals have been sleeping. Great music symphonies have been written the next morning learned from the dream. Scientific breakthroughs have happened when folks, so what the brain is doing in sleep is that it is processing all that information. It's making sense of it. It is categorizing different experiences. It is making connections. It is finding patterns unbeknownst to you, because your body is sleeping. So if you have disrupted that process by not giving yourself a good night's sleep, your brain is losing out on all those benefits of sleep. You're really essentially not making sense of the world because you haven't slept. Your sleep is the time when your brain is making sense of how to navigate. If you haven't slept, you've deprived yourself of that process. Exercise daily. Again, so here's coming from a psychiatrist. The best medicine for anxiety. The best medicine for anxiety is not the medicine that I prescribe every day to my patients. The best medicine for anxiety is exercise. And that's it. That's it. If you can give yourself an exercise once a day, at least for 30 minutes, in which your heart rate goes up 150%, and you start to feel sweat on your body, and you're able to sustain that for half an hour, that is the exercise that you need every day. It washes off the chemicals in your brain that are giving you anxiety and making you nervous. It just washes your brain off. You don't need an antidepressant. You don't need a tranquilizer. You really don't need anything. So what that means is that your resting heart rate is around 60 to 70 beats a minute. If you can do a treadmill or go to a gym, that can raise your heart rate from 60 to 70 to around 100 a minute. That's like a slow run or a brisk walk. And you can sustain that for 20 minutes to half an hour, and you start to feel some sweat coming out. That is the kind of exercise that you need. Half an hour of that exercise every day. It's proven method, better than any other antidepressant or any other medication to help you with anxiety. It gives you a good night's sleep. It makes you calm, and it prepares you for the day. Same. So deep breaths is sort of when you're panicking. Sometimes you're in a situation where you start to panic. You start to feel that you're losing control. Take a deep breath. Count till 10. Go out of the situation, walk out, and once you see that you're coming back and you're relaxing, you can carry on with the activity. So is this the full slide? I thought there was something else in the slide also.
I can check.
Okay.
So Rasikul bhai, if you can reduce the percentage of the slides, maybe we can have more.
No.
I think that was okay. So yeah, I think it was the four. Let's move on to the next slide.
Yeah, this one. This next slide.
Okay, so yeah, so at the expense of repeating myself again, except that you cannot control everything. Basically, at this point of time in this slide, what I'm trying to say is that you make sure that you have people around you that are helping you in areas that you are not fully in command. So places that are avenues, areas that are not your strengths. Make sure that you have complements in terms of friends, individuals, resources that can fill in those areas that are your weaknesses. welcome humor. The culture that we come from, humor is a good coping mechanism. I remember my days, and again, Aligarh is famous for, individuals are famous for their witty remarks. I mean, our culture helps us cope with humor. I think that's one of the good things that we have with us. So keep it going. What humor does, I mean, the way humor works is that it's a paradox. So what is it that makes you laugh? It is the paradox of the situation that brings in humor. So you're looking at a situation, it's a cartoon or a joke. The humor lies in the unstated reverse of a situation which makes you laugh. That's typically a human phenomenon. That's something that only humans can experience. And in operationally, why that matters is that it puts things in context. Again, what I was talking about, oftentimes the humorous situations sometimes are the most revealing. You have political satire that suddenly explains the complexity of a situation in satire, which is only available in the form of humor. So have humor, keep it going, welcome it. Make sure that you surround yourself with a little bit of humor around. If you're reading a newspaper, look at the cartoon, have a laugh. Surround yourself with folks, narrate a joke or something. May I have the next slide, please? So get involved. If you, and this is particularly relevant in these times when you have crisis on such a massive scale, when entire nations are collapsing, when literally entire nations are collapsing. One has to step up. We have seen that politicians have lost the the script, so to say. Nobody knows what to do. Our teachers, our mentors, our professors are helpless sometimes. They don't have a solution. Those people that are running countries, they are at a loss because they don't know how to manage these crazy times. That creates opportunities. That creates opportunities for young adults like you folks. Get involved when your job interviews are not happening. So an example, when college placement is not happening, when companies are not coming to campuses to recruit, there are opportunities that are happening. Stand up, make a self-help group, get together, reach out to the local administration, reach out to companies. I know of some groups that folks in at least in the US, when, and I'll give you the example, when this year on-campus placements did not happen, some kids got together, students got together, they formed a group, and they reached out to their alumni that were in companies, and they started collecting resources where job opportunities that were still there, but the companies were not advertising them because they were, it was not part of the company policy for that year to reach out and do job placements. And so these self-help group, these groups of young kids that were about to graduate, they reached out to their alumni, and they started putting the list of jobs available, and they made something out of that situation. So get involved in moments of crisis. When a system falls, newer ways of replacing the system come up. May I have the next slide, please? Again, as I mentioned, a support group. Make sure that there are people that you can talk to and you can share ideas. And then I think the next slide is also very similar to this one. Yeah, that's just about it. I'm open to questions. Thank you for your time. I know there were some questions coming up, but I wasn't able to keep track of that. I read a response that we could take questions later on.
Yeah, sure. Thanks a lot, Dr. Ali Shamsi Saab, and for your presentation. So we can now start question session. So if anyone has a question, they can type in the chat box, or also if needed, you can mention that, and we can unmute you and you can ask directly. Both works.
Yeah, you can raise your hands if you want.
Yeah. Yes, that would be good. Raise your hand and we can just unmute you and you can ask.
We have this one question from Abhishek Sharma. He mentioned this a couple of minutes ago. So I'll read his question. Sir, how to get into the mood of doing work progressively? I mean, after taking break for 2-3 days, I feel I'm able to focus, but after 1-2 weeks, I feel like I should take one more break and then from the regular routine. This has been happening since last year quite frequently. He wants to know what to do with it, like how to get into the mood where he's breaking up his routine to get a break and then again, and this happening him for 1-2 weeks, every 1-2 week.
Yes, so I'm reading it on the chat. It's sir, how to get into the mood of doing work progressively. I mean, after taking break for 2-3 days, then I feel I'm able to focus on my goals. But after 1 or 2 weeks of time, I think that I need to take a break from my regular. So basically, well, so to begin with, it's quite remarkable that you've actually, Abhishek. So I'm talking to you directly. So I think it's very good that you've actually able to understand what your pattern is, and that's the first step. Is that everybody is different. So what I advise to folks is to figure out what your pattern is, and it looks like you've already done that. So that's the first step, seeing what is it that works for me. So if you think that you work for 2 or 3 days and then so you looks like 1 to 2 weeks of time that you're able to focus, and then you feel like taking a break for 2 to 3 days. I think this is not far at all from what I would expect somebody in your age group to actually do. So this is actually a pretty healthy routine from what I can understand. But the key over here is to keep track of your pattern, and so you think in terms of weeks and a month. So what I advise is to look at that chunks of 3 weeks at a time. So you plan yourself for the next 3 weeks. Have your goals spread out over the next 3 weeks, and then you can move them around. So if you're going through a period and then you find that you need to take a break, and that you had something scheduled or you wanted to do something accomplished during those 2 or 3 days, but you were not able to do that, it's perfectly fine. You can move them around. You have a span of 3 weeks to rearrange your goals and your accomplishments. So it is perfectly natural. That's how the body works. It has to take a break, and everybody is different. If this is how you feel your body works and likes to do, then that's the best way to do. But it helps to give yourself a wider window of 2 to 3 weeks, so that you can move your schedule and your goals around. I hope that helps. And yes, Vasikul, I saw your comment on the benzene structure. That's right.
Thanks. So let me unmute. We have a next question from Mehrosh. So I think I unmuted her. So Mehrosh, you can speak up and you can ask your question directly.
So I can actually read the comment.
Okay,
It says,
sure.
how can one deal with social anxiety and the fear of public speaking?
Sure.
So to cope with, the way to cope with anxiety is to understand that a lot of the time we are anxious about getting anxious. So we go through a process, a situation, we get anxious about it, which is perfectly normal. And then the next time we are anxious about getting anxious. So that's half the battle won right there, that our anxiety is about getting anxious. So as long as we understand that part. Coping with social anxiety and the fear of public speaking. Some of us are natural speakers. Not everybody is. Very few individuals are natural speakers. The vast majority of individuals are just normal human beings, and they will have anxiety in public speaking. It is natural. It's like, you go on a walk, you walk for an hour, your legs are going to hurt, your feet are going to hurt, just body's natural reaction. So if you are standing in front of a crowd and you're asked to speak, you will get anxious. It's natural. So once you understand that you're going to have anxiety, that's also a way of coping anxiety. Then there are certain tactics, for example. So let's say you have a speech, if you have a speech and you prepare yourself, rehearse the speech, knowing what to say is almost all the anxiety taken care of. If you know what you're going to say, you're going to have very, very little anxiety. So preparing what you're saying is one thing. Going to the venue ahead of time is also one way of coping with anxiety. If you're supposed to give a speech and you have the time, you can go around, hang around that place, familiarize yourself with that setting, and then an hour later come back and give a speech, if you can do that. So those are the ways of doing it. But again, it's a practice thing. If it's really, really, really bad, debilitating anxiety, if it's critical for your job, and you have to, and you find that it paralyzes you, you actually cannot do a productive job of speaking and talking to people, then there are certain medications that you can actually take. It's very common for folks to take a low dose of a beta blocker or something, and that helps with public speaking if it's critical for your job.
Thank you, Shamsi Saab. So next we have one question from Uzma Miraz. So I am unmuting Uzma, and Uzma can ask directly. Uzma, can you unmute and ask? Okay. Otherwise, I can read out. Uzma sent me the message question personally. So Uzma is asking, how to cope up with negative thoughts?
So again, negative thoughts, to cope with thoughts of all kinds, negative and positive, is to understand that these are natural, so they will happen. Tell yourself that the situation that I'm going through, this is bound to happen. I will have negative thoughts. what is my response going to be to it? So how you respond to your negative thoughts is basically, who you are, what your philosophy is towards the situation. What kind of an individual are you in terms of what are your basic values? What are your principles? That determines how you counteract the negative thoughts. Disappointment, for example, is countered by a plan. So if you are an individual who has a pattern of anticipating negative thoughts, so I'm going in this situation, and if it does not work out well, I will have thoughts that will bring me down. And if that's what you experience, then it helps to prepare yourself. You can start to train yourself that if this does not work well and I will have negative thoughts, how am I going to cope with it? So once you have a plan of what you're going to do when your thoughts turn negative, you will have the ability to cope with them straight ahead. But it requires a little bit of work. It does require a little bit of work, and once you train yourself, it becomes easy. But going into the situation, preparing yourself, and then immediately coming up with whatever coping mechanism you had. Hope that helps.
Thanks. So we have another question from Ikra. I'm unmuting her, so if she can speak up, or also she also wrote in the chat box. Otherwise, you can also read.
Yeah. So yes, sir. Could you please share some strategies to deal with OCD symptoms, considering the fact that currently people are extremely fearful on catching the virus? So OCD. Psychiatric symptoms are always context based. So, for example, and I'm not sure if you're using the word OCD in general terms or if you're actually specifically mentioning the disorder OCD, but my answer is going to take care of both. So it's always context. So human behavior is always context driven. The same behavior in a different context, it can be considered as normal behavior, healthy behavior, so to say, and the same behavior in a different context can be considered unhealthy behavior. So if you are going through so let's say you're in this hand washing ritual, I'll give you an example, and these are normal, usual times, and you're washing your hand and you're washing your hand too much, that's healthy behavior. But if you're in a situation where there is dirt and there's disease everywhere and you're washing your hands too much, the same ritual is healthy behavior. So I don't think that in the coronavirus situation, any amount of obsessing for safety and cleanliness will be considered OCD behavior. In fact, do whatever it takes to keep yourselves safe and healthy. The ways of keeping yourself safe from coronavirus, it's right there. It's being talked about a lot. You have to wear a mask, you have to wash your hands, you have to maintain distance. And if you find yourself overdoing it, I think it's okay. Again, nobody has the right answers over here. This is an evolving situation. We thought the virus, sometimes we say the virus spreads it does not spread by surface. Then we say the virus spreads by surface. Sometimes we say that 6 feet is the right distance. Sometimes we say 3 feet. Sometimes we say 10 feet is the right distance. So again, there is no science over here. We are facing with a very deadly disease that spread very rapidly, that causes a lot of devastation, and we have science that is just catching up. I mean, it's October. All this happened in February. So we are sort of 8 months into it. Millions of people have been infected. Hundreds of thousands have died. So there is really no science over here at this point of time. And if whatever makes you feel comfortable, if it gets too much, then hopefully somebody around you will advise you. But I would suggest that you do whatever you feel makes you comfortable, staying safe. Hope that helps.
Thank you, Dr. Shamsi Saab. So as we came to know that you have to go at 10:40. So to another assignment. So we are taking only 2-3 more questions. The first question is one question I can see. Zishan Hassan asks how to deal with social anxiety, fear of new people and places. Sometimes it is important for me to go into groups which I'm not generally part of, and it brings our social anxiety, and I can't be free with them.
So the best way of coping with anxiety in a group is, there are certain techniques to it. What I tell folks is that when you're entering into a group, the best way to start is by introducing yourself. And a lot of our social customs have sort of, evolved around it. You're entering into a group, you introduce yourself, my name is such and such, and then ask the other individual, start a conversation with them, a small conversation. Once you introduce yourself to some individual, the natural reaction of the other person is to introduce themselves back, and so you go one by one with that group. But the key over here is to start a conversation. There are several different ways of starting a conversation, depending on the setting that you're in, depending on the reason why the group has got together, depending on the common things that are between you and other members of the group. The key is to start a conversation. One way of starting a conversation is introducing yourself. There are many other ways of starting, but that's the best way. Once you start a conversation with different individuals, you can see that your anxiety will go down a lot.
Thanks a lot. Then we got another question by Ruksar Ahmed. How to stop overthinking while going to sleep?
So sleep is a matter of habit and routine. It really is a routine. If you don't have a routine in place for sleep, it's very difficult to get sleep. So it takes time. The best advice I give to people on sleep is to have a routine, a set routine, and it has to come with discipline. You go to sleep at this particular time, and you have to wake up at that particular time. There is really no other way to do it. Once you have that routine in place, your body automatically adjusts to it. It really does. We are creatures of habit. Humans are creatures of habit. We are just creatures of habit. We will do what we have trained ourselves to do. It takes a huge amount of effort to change our habits. What that means is that once our habits are in place, it takes a huge amount of effort to affect our habits. So for example, if you have decided that you will go to bed at this particular time of night, no matter what, then your brain will set itself in that. And then your brain will fight anything, including the thoughts that will stop you from going to sleep. I promise you that if you force yourself to go to bed at this particular time of the day, you will have one night where your old habits will stop you falling asleep. You will have the second night where you have your old habits stop you from falling asleep. You'll have a third night. By the time you have your fourth night, your habit of actually falling asleep at that time of the night takes precedence. It will become a stronger habit. And no matter how much of thoughts that come in, they will not stop you from falling asleep. So my promise to you is make a pattern, set a time, and give yourself 3 or 4 days of sticking to that routine, and I promise that you will go to sleep.
Thanks a
Anything
lot.
else?
Okay, so Sarah, I unmuted you. Sarah, you want to ask?
Yes.
Sure.
Yes. Can you hear me?
Yes, we can.
Yes, I can hear you.
Okay. So good morning, everyone. Thank you for the wonderful presentation, Dr. Shamsi. It was really insightful. You did mention about replacing negative thoughts with positivity. I mean, I'm experiencing anxiety for quite some time now, and now it has led to pessimism. I mean, I was pessimistic before, but it has worsened in the past few months thanks to the pandemic. I have tried to be positive and have happy thoughts, but there is no motivation. Can you suggest me how to stay motivated so that I can at least stay positive? Or is motivation really necessary to be positive? I mean, because of anxiety, as you mentioned, there is no roadmap, so it's really difficult to be motivated and hence being positive. So, are they correlated, or I can be positive despite being not motivated?
So the what we are going through are unprecedented times. There,
Yes.
this happens. This is once in a 1,000-year situation. So what happens is unprecedented times. So there are two things going on over here. Is so you have so there is the issue of motivation that comes from a goal, and goals come from from opportunities. So you if you don't have a goal, it's hard to have a plan, and then it's hard to have a motivation to implement that plan. So that's probably what you mean by motivation. And then there is the issue of positivity, which are you going to be positive about a situation which is difficult? No. So it is okay to be negative about a situation that is negative. However, should that make you feel miserable? The answer is no. Should that make you feel sad? The answer is no. Contentment, being content, and being happy about yourself, about situation, is one thing, and being negative about something that's tangible. So for example, let's say there is no job interview. You're not going to, let's say you know that the next 1 year you're not likely to have a job. There is no way you can feel positive about that situation. There's nothing to be positive. You are not going to have a job. So don't fight the disappointment that comes with it. Now, but should that make you feel miserable about yourself? No, absolutely no, because that is the way the situation is. You have to find ways of being content about yourself. Sometimes accepting a loss is the best way to feel content. I mean, there are no hard answers to it, but you can still work on replacing yourself. So for example, you don't have anything that you are doing for the next year because you don't have a job. It doesn't mean that you don't do anything. There must be something that you could do. What is it that you want to do? What is it that you want to replace yourself in that 1 year? Things will get better. This will pass. This will definitely pass. I mean, this is not a sort of a cliche. The virus will go away. That is the nature of the virus. This disease will go away. So you might have a break of a year. You might have a break of 2 years. Come up with something else that you can do in the next 1 year or 2 years. You can develop a new skill. You can contribute somewhere differently. You can contribute to your family, your society. You can come up with something else to replace yourself. So, but it is okay to be disappointed about that situation. I hope I'm able to explain what I'm trying to say over here.
Yes, I understood. Like, I need to accept the fact that things may not be negative, but that shouldn't lead to a disappointment, or that shouldn't make me disappointed or anxious.
Exactly.
Yeah. Well, thank you so much for answering to my question. Yeah.
Thanks, Sarah. So now we got another question from Ikra. How does one control procrastination in these anxious times?
Uh, so procrastination. Some people are by nature procrastinators. So I mean, again, what you mean by procrastination? How do you define? Some people are by nature, they leave things to the last minute, and then the crisis is what keeps them going. The good and bad things about it. Some people are the opposite of that. Um, a lot of what is happening around is, and I see this even in the US, people don't have a job, and so it's there really is nothing to do, in the sense that, as I had said earlier in my talk, that the way we plan for the future is, the way we think about the future is, we have a script. We have an image of ourselves doing such and such thing. We're literally reliving that image of ourselves doing such and such thing in the future, and that's what we are looking forward to translate in real life. So we are watching a movie of ourselves doing something that we think we will be doing 6 months from now, 1 year from now, 2 years from now, and we are constantly running that movie in our head. And when something happens to us that we know that situation never happened, that movie goes away, and we don't have anything to replace that movie. And that's the lack of motivation. That's when procrastination comes in. So replace that movie with a different movie. Just imagine yourself doing something else. You had plans for yourself, and you're not able to implement those plans, so you probably don't have that kind of motivation, and you're probably giving yourself excuse to procrastinate. So replace that movie with a different movie, which basically means reset your goals. Find something else to do. Believe me, around us there is tons of stuff that we can do. It may not be what we wanted to do a year ago, but it doesn't mean that there's nothing else to do.
Thanks a lot. So then I think one more, maybe the last question, Zishan Hassan. So Zishan, I have unmuted you. Please speak up. Hello, Zishan. Are you asking me a question? Hello, Zishan. Okay. If not, is there any other question by anyone else?
Vasihul, this is Ali Rizvi. I have a comment to make, a very brief comment. The last question that I think was raised by Ikra about being positive in these pandemic times or something, and Ali Bhai answered in a very nice way as to how we have to work ourselves to make us believe in ourselves, and that this will pass by also. So somebody sent me, and again, he was mentioning earlier about how to have the sense of, have a good laugh, enjoy what you in daily life, find ways to smile at, some jokes, snippets, some cartoons. So somebody sent me a cartoon about 2 minutes ago, and I'd like to share it right here with you all. And this says, Obama, he's talking to Biden, and he says, President Trump has the coronavirus, and we should send him a card. And Biden said, can I write in it, stay positive? This is just a joke, but I'm just trying to say how people have to unwind from the complexities of daily life and be able to find some ways to laugh and enjoy and contain the negative thoughts that come within us, and they come into everybody. I mean, I was sitting and listening to all these questions being asked, and Dr. Shamsi answering them, and believe you me, many of these things have happened to me, and they happen to me as well even now. So, so this was a good one I thought to share. But please proceed. Go ahead. Thank you so much.
I think Farhan Khan wants to ask questions, so I'm trying to unmute him. And also Zishan has issue with the audio, so I asked him to type the question. So Farhan, please go ahead with the question.
Yeah, am I audible?
Vasiful,
Yes, you are.
has Dr. Shamsi been disconnected by way somehow?
Uh,
Can you check?
Yes, it seems like he is no longer in the group.
Interesting. So can someone
Let me
check?
see.
Yeah, if you can check him, check with him.
Yeah, I'm asking him right now.
Yeah, so maybe we will conclude in few minutes. So we are almost done.
Yes, yes, yes. So while we have your attention, let me give you one more of a sequel, and to all the brilliant scholars we have of SSGSA here, that Dr. Shamsi talked about the chai, limit our chai because of the caffeine. And here's a good joke that you will all will enjoy, and this joke is that in heaven, uh, we have heard in heaven there are दूध की नदियां बहती हैं जन्नत में. So there was complaint sent to the management in heaven that कि दूध की नदी बह रही है, उसके पास में बहुत सारे लड़के लड़कियां बैठे हुए हैं. तो उनसे शिकायतें पहुंची कि साहब इन्होंने क्या किया है कि चाय की पत्ती डाल दी है दूध की नहर में और शक्कर डाल दी है, सब बैठे हुए हैं. तो लोगों ने पूछा तुम लोग कौन हो, तो उन्होंने कहा हम लोग सब अलीगढ़ के लोग हैं. ये अलीगढ़ में इतनी चाय होती है that we are having chai in heaven. So one more joke. Oh, Ali bhai has joined, I think.
Yeah. Sorry, I got disconnected. Can you hear me?
Yes, we can. So Farhan, you wanted to ask something. So Farhan, please go ahead. Farhan Khan.
Yeah, hello, sir. I just joined the job. It's been 2 months, and I got a job in this pandemic time. I consider myself very fortunate for it. But the problem is, what happens is when we deal with the work related stuff that is just I've just joined, so it's basically a learning curve right now. So what happens is your manager expects something out of you, and working from home in this situation, it is not always possible to. Even though they organize some conferences like get us acquainted with the technical stuff that is going on in the office, but it is not always possible to be at par, and to be at the office is something else rather than working at home. So the efficiency automatically decreases. So how to manage that stress that you are not able to be at par with the expectations that has been put up to you. So if there is any solution or how to cope with the work related stress that is going on, if you can help me with that, that will be very beneficial for me.
Yes. So in general, as I had mentioned earlier, there's some broad principles, and that is about making sure that there are individuals to help you out. So this is a classic situation when we enter a novel situation. It could be a new job, it could be a new university, it could be a new relationship. We are trying to understand how it works. Even if this was not the COVID situation, it was nevertheless a new job for you, a novel situation, as to say. And the key is to quickly find resources that can help you. And most of the times, almost always in those situations, it is individuals. So you have to very quickly find somebody in the job at work who can help you. Give you advice, warn you, serve as a mentor. I mean, some companies actually have individuals, they actually appoint a mentor. But again, the big key over here is that the big key over here is to make sure that you reach out to individuals, to speak up, so to say. Rule of thumb, any normal situation, you talk to people involved in that situation about what you're experiencing, the help that you need. Until and unless you ask for help, you will not get help. It should not be seen as a sign of weakness. Nobody has all the answers. So talk about it, ask for help, and develop relationships with individuals that will be your support system. The idea is to identify individuals that you can call as your support system. These are the people that I'm going to turn to when I need help and advice. And that's across the board in any situation, including a new job, including pandemic or not.
Thanks a lot
Right.
for your answer.
Thank you.
So then we will take the last question from Zishan. So he has written the question. Sir, you said during the presentation to take a pause in this situation, but even if we want to take a pause, the world around us is not pausing. Online classes are going on, and people around us are not being empathetic of the situation. How to deal with this? The lack of empathy of people around you, and not be bothered about your response, and be contempt on your own, no matter outside reaction.
So pause is, you have to take a pause. It's like the axe cutter who was cutting the tree, and he had an axe, and the axe was wearing out, and somebody told him that you need to sharpen the axe, and he said that I don't have time to sharpen the axe, I have so many trees to cut. So if you are in a situation where you feel the need to take a pause, but you don't have the time to take a pause, you probably did not take the pause earlier on. So and by pause, I don't, again, it is context driven. The slide that said take a pause, that particular slide was about anxiety. If you are experiencing an intense anxiety, and in that moment when you find that you're helpless and it's taking over your body, in those situations, that's not very common, the larger audience over there, that's when you actually have to take a break. You literally have to take a pause, so that you can get your breathing right, you can get your perspective of things right. It's a physiological phenomenon that the body is going through. So that's what that particular slide talked about. But in general, you have to take pauses, and you have to reflect where you're going. For the simple reason is that until and unless you don't take a pause, you don't know what is it that you're doing wrong. So even if it is not about you trying to find out how to do things the right way, you have to take a pause simply because you need to know what is it that you're doing that is wrong, that you have to correct. Yes, of course, there are some situations where you absolutely cannot take a pause, and that's fine. But look for the next situation that you can take one. Hope that helps.
Yes, so we are, thanks a lot, Dr. Shamsi. We are not taking any more questions because I think there are no more questions we can see. And also, I think we are running out of time. So I will like to thank Dr. Ali Shamsi Sahab for this, for giving us this wonderful presentation, and also answering a lot of questions. I'm sure that may have helped a lot to all the people who have asked questions, or also those who didn't ask those questions, but those questions they may also have those kind of similar questions. So we have also recorded the webinar. So for those who couldn't attend, I'm sure they will be helped by the recording as well. So thanks a lot, Dr. Ali Shamsi Sahab. We are grateful to you for taking out your time and coming to us to speak and to answer, giving us wonderful suggestions. Thanks a lot again.
Thank you very much. It's my pleasure, and thank you for giving me the opportunity. Thanks for all your help on this.
Thanks a lot. So we conclude the webinar here.